Today, when you hear about research, what comes to your mind is a scientist in his lab coat doing some experiment, or a doctor talking to a patient and trying hardly to explain a study process, answering questions, showing benefits and risks of participation, respecting the patient's autonomy, and trying hard to get the patient's satisfaction. Behind this nice image, is a blood-stained history of research, where participants were forced or unaware of participation in medical experiments, where minority groups, prisoners, psychiatric patients, and others, were used in unethical and even criminal ways, and a lot of them died as a result of an experiment. Some extreme examples on such practices are the Nazi experiments in the concentration camps, the Japanese experiment in China, and the Tuskegee syphilis experiment in Alabama. All those scandals and others throughout history have led to a serial of trials that eventually led to new codes and regulations, where the first and the most important principle in any research participation is the voluntary consent given by the subject after being informed and understand the nature, the duration, the purpose, the methods and means, the inconveniences and hazards of the experiment. But what about children? How to get their consent? How to explain such a complicated subject to a child? And what are the challenges that will face us in dealing with such a vulnerable population? First, we have to understand what informed assent is. Informed assent describes the process whereby minors may agree to participate in clinical trials. It is similar to the process of informed consent in adults. In this video, we will be talking about the challenges concerning child's consent or assent for research participation. These challenges include but not limited to age and maturity-related challenges, social and cultural background differences, parental communication challenges, disagreement between parents and child, and legal guardianship. With the COVID-19 pandemic, further studies in the pediatric population had to be done, as we cannot always extrapolate the adults' research results to children. Despite the potential risk on such a vulnerable group, conducting such studies is a necessity, as it will benefit the whole pediatric population by conferring protection and immunity against this virus, which will eventually decrease the risk of developing severe, or sometimes fatal infection. To discover these challenges, we asked 4 parents who live in Lebanon questions related to COVID vaccine clinical trial, and about their opinions concerning their children's participation in such studies.
اوكي هلا بالنسبه للموافقه المسبقه اذا عم نعمل بحث مع الاهل والاطفال حيكونوا موجودين بهذا البحث، افضل انه ناخذ راي الاهل كأم وبي كالولد.
Before the child's participation in any research activity, child voluntary assent must be obtained. One parent approval is enough in research with no greater than minimal risk to children, or research involving greater than minimal risk but presenting the prospect of direct benefit to the individual subjects. Whereas, we have to obtain both parents' approval in studies that involve greater than minimal risk with no prospect of direct benefit to individual subjects, or in research that presents a reasonable opportunity to further the understanding, prevention, or alleviation of a serious problem affecting the health or welfare of children.
أنا بعتقد من وجهة نظري إنه من عمر 1 لعمر 12 أنا باخد القرار عن ابني، لأنه هو ما بيقدر ياخد قرار لنفسه. من بعد 12 سنة بعتقد هو بياخد القرار.
Unfortunately, things are not that easy, and there is no one universal age cutoff to determine if there is a need for a child assent or not. To take part in the assent process, the child must be mature enough to understand the trial and what he or she is required to do. Some guidelines suggest a requirement of assent starting at a school age threshold. But, this age varies depending on the child and the group running the trial.
بالأساس بما أنه أنا قبلت إنه يشارك بهاي التجربة فلازم يكمل للآخر، بس بشرط إنه ما نخلي هذا الشيء يكون غصب عنه، لازم يكون بقناعته. وبالنهاية هيدا في له مصلحة لإله يعني، وأنا بعرف مصلحته أكتر منه.
Child voluntary assent must be obtained without coercion. Even with guardian permission, if the child dissents from participating in a research, the child's decision prevails. However, the assent requirement could be waived in very specific cases. Conversely, if a child agrees to participate in research, the permission of the parents or guardian must be obtained.
أنا برأيي المعلومات اللي بدها تنعطى للأهل حول تعمل كوفيد فاكسين هي لازم تكون شاملة بكل الأشياء بس حسب الأهل. بس للأولاد لا، الأولاد كمان بدك تعطيهم إياهم بطريقة مبسطة أكتر، مثلا نرسم لهم شي صور، نفرجيهم فيديوهات صغيرة.
The disclosure of information required for voluntary and informed parental permission is the same as that required for informed consent and includes a discussion of the potential risks, benefits, and alternatives to research participation. The regulations do not specify the informational elements that should be included in a child's assent. However, the research team has to explain this information to children in a language they can understand using written forms, videos, graphics, and other visual aids. Researchers also need to take into account the nationality, ethnicity, and socioeconomic status of their potential subjects in order to design appropriate parental permission and child assent processes. The COVID-19 pandemic is pushing science and ethics into unexplored terrain. As with any research involving children, the major concern remains on how to protect the minor's rights, dignity and well-being, yet advance science and general knowledge in a way that could benefit them as well.